Hi everyone and welcome back. I'm Dr. Ryan Whitaker here with my partner Dr. Rich Luekenga. We are representing the Hearing and Balance doctors, local doctors of audiology based right here in St. George, Utah. We want to continue our discussion today of cognition. In our last video we talked a little bit about the link between hearing loss and cognitive issues. Specifically, we talked about issues of cognitive load and neural degradation. Today we want to talk a little more specifically about the links to dementia and a neat test that we have here at our clinic.
Yeah, recently we acquired a test that's FDA approved called the Cognivue. Basically is a quick snapshot judgment or a view of how we're doing cognitively. So it's a really interesting test. There are a lot of links that are showing a relationship between the slow change in our cognitive function and how that kind of mimics the slow change we have as individuals with our hearing loss. And so there's a relationship that they're finding that how we're reacting and responding throughout our life with our hearing, and as our hearing is changing slowly, it really does have quite an effect on our brain. And so in our clinic, we're taking a proactive view. We're taking a proactive approach to trying to figure out how can we monitor and help our patients stay on top of their cognitive function.
Yeah, and this Cognivue is a really neat test. It's really simple to use. It's used with this little joystick that you can see here. It takes you through some simple little tests, and it gives you that snapshot of your cognitive abilities at one moment in time. This link between cognition and hearing loss has been well established over the last decade. You may have heard about it at some point, but it's very real. We often get asked, is it real? Is there really a connection between dementia and hearing loss? And the answer is yes. And this all began about a decade ago, and the research has continued to pile up, showing that there's a very real connection between these two.
Right, and a lot of people, they get nervous about how am I going to do? I already know I'm brain dead, or they say funny jokes like that. But the reality is, when you step into this test, it takes about 10 to maybe 15 minutes at the most. And so it's not a very difficult test, and people come away feeling very, very rewarded. Much like anyone who's taking a proactive approach, when you walk away and you have more knowledge about yourself, you just feel good inside, and you feel like you know that you're doing well, or you know that, maybe I ought to talk to my family doctor more about how I'm doing with my brain, with dementia, or with my cognition.
I agree. It's kind of a fun test to take. When I took it, it was kind of like a video game. It was kind of fun. It was neat to see the results. If you're interested in having your cognition screened, this is a fantastic tool. Give us a call. Come by and see us. We'd be happy to help you out.
Yeah, we'd love to help you, and thanks for listening.